It's our second webinar, and we are very excited because we are thrilled to have a community, our healthcare community, and you will learn a little bit more today, not about the healthcare community and career pathways, but also about the Slack community. This is what we sent out last week to you to join, and those who already enrolled, welcome. We are excited. We saw several already on the Slack community. If not, we will add a link today on the chat box, so you can click on it and enroll. And also I will be sending out an email after today's webinar with a link to join as well. So we highly recommend for you to join our Slack community. I don't want to take too much away, because you will hear more about Slack from my colleague Leila today. So the first thing, please mute yourself. We love to hear your voice, but when we have over 20 participants and everybody wants to speak, it will be a little bit chaotic. So if you have any questions, please use the chat box. Later on, when we have our Q&A, we are more than happy to take your questions. And also, if you unmute yourself, that should be fine, depending on the time we will have. If there are any questions we will not be able to answer today, please make sure to follow up with your advisor, because it's important for us to be here for you and to answer any questions, concerns you may have. Also, the webinar is recorded, so you have the chance to watch it again, because it will be so wonderful today. So before I will start, just a quick introduction from my colleagues. Yes, I'm Patricia. Sorry for starting first. I'm Patricia. I'm in the DMV region, working with healthcare job seekers for over 2 years, and I'm very happy to see you all here today.
I'll go next. So hi, everyone. My name is Leila. I am also a job advisor, just like Patty. I'm based in the Western region, so working with job seekers in California and Washington. And I've been with UpGlo for over 4 years, and I'm so happy to be here with you today.
I'll do that again. Hi, I'm Tamar. I hope you can hear me. I am also a job coach with UpGlo. I sit in the Chicago office. I've been at UpGlo for about 7 years, and I am head of the healthcare community, this amazing team of professionals and job seekers, and so excited to see so many of you here and launch this important work.
Hi, I'm Sarah Olson. I'm the program director for UpGlo's New York office, and I'm a former healthcare advisor, so I have a long time interest and investment in our healthcare job seekers and community, so I'm very excited to be here today.
My name is Kayla. I am the volunteer and partnership program lead here in our Chicago office, and I'll be working with the healthcare team to help connect all healthcare job seekers to volunteer and event opportunities. Really excited to meet you.
Isaac?
Isaac.
Hi, I'm Isaac. I'm organizing the chat and moderating.
Well, Isaac is also a very important part of our healthcare team. So, yeah. So this is our team, and as I said, please feel free to reach out to your advisor for any questions and, of course, for support. I know we are currently working on a lot of residency personal statements. Don't forget to send your advisor your personal statement. Just a little side note. So again, sincerely, with all of our hearts, we want to welcome you today to our Healthcare Career Pathway and Slack Community webinar. Today, to talk about the agenda first, would you mind, Leila, to switch the slides? There we go. So here you can see a little bit about what you can expect to hear today. We will first talk about the career community, which is the community we want to build with within our healthcare job seekers. We will learn more about the team introductions, which we basically already did, and career pathways, which we divided in several areas, among others, residencies, global health, public health, nonprofits, clinical research, hospital, clinics, industry, dentists, pharmacists, and nurses. Afterwards, you will hear about Slack and what our main goals are, what is Slack, and you will see a small or short tutorial from Leila to introduce you a little bit more into the community on Slack. And you will see the next steps, and we will have probably time, hopefully time, for job seekers' questions, for your questions. So my colleague Sarah will talk now a little bit about what is the career community.
Thank you, Patty, and thank you everyone for joining us today. I'm just going to talk a little bit about how we have come to this point with our program. So as you know, obviously the COVID-19 pandemic has really changed the United States workforce and the economy, and that also changes the way that Upwardly Global thinks about our work with you and with employers and just in the larger job market landscape. So one of the things we've been doing this year is starting to study the labor market shifts, building new career pathways, tools, and plans to try to connect you all with opportunities in these high demand sectors of the job market. And one of the sectors that we are really focusing on, and it's really kind of led the way, is our healthcare sector. In part because this team is just amazing and they're so invested and have so much knowledge. It's just a natural place to start. So we're really excited to have you all here today because we're kickstarting this healthcare career community, and you all are going to be the first members of this community. And to us, that is a big deal, and we're very excited about it. So just want you to know that we do have several other career communities we're going to be focusing on, including IT, finance, accounting, business functions, and engineering. And we are going to continue to offer services to our other professions, but the focus on these 5 areas, including healthcare, is going to be really tied to that labor market research, to employer demand, and really it's going to help us focus our drive and our attention on doing everything we can to help people in these high demand markets connect with jobs and employers. So we're really, really, really excited to tell you all about everything we've been working on. And I'm going to hand it over to Tamar and Kayla to tell you a little bit more about what it's going to mean to you to be part of this community. So thank you again for joining us.
I am unmuted. Okay, so thanks, Sarah, for that little preview and explanation. So as many of you who've been around for a while know, we've been working in this space for a long time. As Sarah mentioned, we've developed expertise. We've been in the Upwardly Global is celebrating 20 years now of working to support job seekers in all careers, and healthcare is certainly one of them. It is the area of growth and opportunity, and it's also a complicated area. I don't have to tell you all how highly regulated the field is, how complicated it is if you come with a training and a license from another country to join your career in this country. So what we have developed is lots of experience and a real passion for working with you all, as well as understanding of various pathways. So we're going to really build in and continue our high touch coaching, understanding these pathways and being a little more explicit with you all to say, where do you think you can go? Where do you want to go? What makes sense? And so the One of the pieces of this will be the coaching, and the other will be the Slack community, which we've been talking about, which we'll all learn together a little more about. It's a new platform for us. I know, you've done training on UpGlo, and we spend time on LinkedIn, and here is another platform, but we think this will be a great way for us to communicate efficiently, effectively, and to help you all connect with each other directly, to support each other, to share information. So we're really excited. We hope that you will all join and encourage other folks in your network to join. Our Slack community is not going to work if we don't have participants and conversation happening. And then another big aspect of this career community is going to be supporting skilling. This is something we haven't talked about as much in healthcare, but UpGlo's been working for a number of years now to think about courses, certificates, certifications that can help professionals, internationally trained professionals, advance in their careers. And as mentioned, in the healthcare space, this has been a little bit complicated because there aren't just simple certificates that will help you get the same jobs you had in your countries of origin. So we are working to understand this space, to understand resources. We'll talk a little later when we get specifically into the career pathway areas, highlight some of the spaces where we're really focusing our reskilling, but we know that this is a big resource, and we want to be able to support you and guide you in your career pathways, and understanding what skills will help you advance. And now I'm going to pass it on to my colleague, Kayla, who's going to talk to you about volunteers and other aspects of the career community.
Awesome, thank you. As I mentioned before, I work with our employer partners and volunteers. So my piece of working with the healthcare community is to help support you as healthcare job seekers to connect directly with our volunteers and mentors. We have a wide pool of volunteers and mentors in all industries, and we are also collectively working more on getting more healthcare volunteers to help guide you, as well as alumni who have been directly in your shoes, who are now working in different roles and opportunities in the healthcare space here in the U.S. And connecting to these volunteers and mentors is going to be a really great way for you to individually one-on-one talk to either an alumni or volunteer and learn a little bit more about how they got into their specific role or their specific industry, or how they got into the job that they're working right now. Alongside with that, this healthcare group will be working to provide more industry-related events all around healthcare, and even specifically with different parts of what it means to be in healthcare and the different types of roles that all you job seekers hold. We will also be collectively building more and stronger employer partnerships with different healthcare providers, working with universities, hospitals, corporations, and nonprofits, and really trying to find different roles and opportunities that can be really accessible to you and to help you find how to get into those roles, and for them to understand the profiles of our job seekers. So when they receive those resumes, they have a strong understanding of who you are and the skills that you hold. And then lastly, we will also be working more on utilizing market research to inform our work so we can help inform you. We'll be doing more market research specific types of roles and pathways that born professionals such as yourself here in the U.S., how you can navigate and get into the different careers and pathways here in the U.S. and really utilize the skills and education that you bring. And we're really excited to bring all these opportunities to you and be working really hard to bring them and share them in the Slack channels.
Awesome. Thanks, Kayla. So we're going to go through some various pathways. As I mentioned earlier, we are starting this work. So we really will appreciate your feedback and thoughts as we move forward. Layla's going to talk more about the Slack itself. We are not launching all these various channels today. We want to build on one at a time. So I will be talking a little bit about medical residencies, and then my colleague Patty is going to talk about global health, public health, and nonprofits. Layla's going to talk about clinical research. I will talk about hospitals, clinics, industry, a little bit for our dentists, pharmacists, and nurses, and then we will get into the specifics of SLAC. So in terms of medical residencies, so we know many of the folks who come to Upwardly Global with a background in healthcare are doctors, international medical grads, for those who are not familiar with that. We work with you intensively already, but we want to figure out more efficiencies, more effective ways to support you. This is a channel that we have already launched on Slack. We believe that in addition to what we can offer, you have much to offer each other. So we're hoping really to have robust conversations here. Hoping people will be generous with advice and thoughts and questions, and know that this is an area, of a significant amount of learning and sometimes some stress for job seekers, because this is really a competitive process. So we certainly understand that. We also know that there are areas that we have very strong backgrounds and understanding. We are very confident to help you with your ARIS applications, with your personal statements, preparing for interviews, but we'd love to find more resources for USMLE prep and access to US clinical experience. So hopefully as we work together more intentionally and have a broader way to communicate, we can enhance this work. So this is a little bit different of a career pathway. It's something that you could be interested in and join the conversation, even if you're not sure that you're going to apply or you're not planning to apply this year. One of the things we know about our healthcare professionals is oftentimes you're looking at a number of pathways at the same time, and that is certainly okay. But we do want to encourage you to really be thoughtful and dig in to some pathway to help you move forward. So we will continue to discuss this as this community advances, but that's a little overview of the medical residency career pathway. Now I'm going to pass to Patty.
There we go. No, I did the same as Tamar. So thanks so much, Tamar. Can you all hear me? I hope so. Yes, perfect. Thank you so much, Tamar. And a reminder, don't forget your personal statement to send to your advisor. I'm mentioning this because, we also need time to review and we want to make sure to help you. So please work on your personal statement and send it to your advisor in the next week or so. Another career pathway is global public health and nonprofit international development. It sounds like a lot, and I want to emphasize that this is something new that probably, from my experience when I work with my job seekers, a lot of job seekers in healthcare don't even know that this is a opportunity as a career pathway for you. So my first advice is, if you have interest in global public health, and you will learn more, it says down in the presentation, so I don't want to take too much away today from this pathway, but we will have an extra webinar specifically for global and public health on October 22nd. You will receive an invite next week, so stay tuned for that. But if you have interest in one of these global public health fields, and I would be actually curious how many of you are interested. So if you could, in the chat box, just write GH or PH or ID for international development, global public health, so I can see how many of you are actually interested in this field. Contact your advisor and work on your transferable skills. There's so many skills that you all have that you may not be aware that you can actually tap into a different healthcare field. For instance, program project management. PMP. You don't need to have specifically a PMP, but if you had project management, program management experience in a healthcare field, these are important skills that employers in this area are looking for, especially with foreign international skills. We collaborate with partners such as FHI 360, and this will be another part of the next webinar. But they are constantly looking for people like you with foreign skills, with experience in third world countries, underdevelopment countries. So especially with technical expertise, and this is why global public health is so important for you all, with malaria, HIV, epidemiology right now, infection diseases. So all of these skills are important. So I want to encourage all of you to take a look on your skills and consider this as a pathway for yourself if you are not interested in residency, or maybe even in future. So possible titles and roles for this, and these are only a few. I will highlight in the next webinar more. A program coordinator, program associate, program officer, technical advisor. So these are just a few selected just to give you an brief overview of what you can apply for. Yeah, I'm very excited about this, and I'm very excited to see some of you and maybe all of you in the next webinar about global public health. Thank you so much, and I will give this slide to my colleague Leila.
Thank you, Patty. So I also wanted to talk a little bit about the clinical research career pathway. And as Patty mentioned, we're just broadly going over these pathways, and we will have webinars on each of these specific topics in the past. So to give you a sense, clinical research, well, first of all, what is clinical research? Clinical research is a branch of healthcare science that determines the safety and the effectiveness of different things like medications, devices, diagnostic products, or even treatments intended for human use. And by its nature, it's very regulated. So what types of places tend to hire for candidates in clinical research? Hospitals, clinical research organizations, also kind of, you might hear that acronym CROs, research institutes, government agencies, some doctors' offices may even be hiring, or even biopharma or pharma companies hire for these types of roles. So certification. Certification may not be needed to get into the clinical research field, although some roles may require it. Always look at the job description. And I would recommend, if you are planning on taking this career pathway, considering to get certification in the future. So for example, the Association of Clinical Research Professionals, ACRP, offers a certification exam for a certified clinical research associate that entails you proving hours of work experience that's related, plus demonstrating some educational requirements. So that could be good down the line. Types of roles. So a great entry point into clinical research is as a clinical research assistant, or it could also be called a clinical trial assistant. And just to give you a sense of the pathway in the future, you can then transition into a clinical research associate, and you can from there move on to clinical research manager. So there is a very kind of strong, clear pathway you can take in pursuing this type of clinical research field. Key areas of knowledge, it's essential to have knowledge of good clinical practice, which you might hear as the term GCP, that's the acronym. Phlebotomy can also be useful to have, a certificate in phlebotomy, and knowledge of HIPAA, which is Health Insurance Portability and Accountability Act, that relates to privacy. So that's useful, sometimes required. So where can you get this kind of knowledge? There are a variety of courses that are available online. Coursera has a few, but there are more formal options. Like, for example, email your advisor to hear about more options. A great one is Northwestern University that offers a 5-day online course for clinical research coordinator, and it comes with a cost of around $500. There are other options out there as well. So email your advisor to get some advice to talk more about it if you're interested. Lastly, volunteering is a really great way to enter this field. And with UpGlo candidates who have landed jobs in clinical research, we've actually seen that most of them start out by volunteering if they have a background as an IMG, so a doctor or any kind of healthcare background, but haven't done clinical research yet. This is a great way to enter the field. So I recommend looking for volunteer postings online, but you can also try emailing clinical trial managers or hospital research administrators to ask them if they need any volunteers to help with clinical research projects. Now I'm going to hand it over to Tamar to talk about the hospital clinic industry.
Hello, I think that worked. Very excited about this area. A lot of our job seekers, want to use their healthcare experience. They want to use their skills, and they want to find jobs that are more immediate. So we get a whole range of various specific roles as medical technologists, allied health roles like medical or surgical assistants, EKG monitors. So a lot in that allied health space, and then also in the administrative space of helping run clinics and hospitals. People who, everything from receptionists and medical assistants to, higher level managers. We also see folks looking for opportunities in medical billing, coding, file review, both on the hospital and clinic side, but also working with insurance companies. And those are all ways that job seekers can utilize their knowledge of healthcare and medicine in a new way, generally. Although some of you do also come with that specific background, and we are happy to help support you as you move into similar roles. This field can be less regulated than this area of healthcare. This pathway can be less regulated. And though we are also looking to really understand more deeply the skilling requirements, looking to understand who's doing, the best medical billing and coding training. Are there medical assistant trainings or certifications that we could help you get more quickly that would help guarantee role? So that's a conversation we're having. This will be a pathway for a lot of people looking in different directions, but we believe that there are real opportunities. And as Kayla talked about, we're really putting also a lot of energy into building relationships with hospitals and clinics and other institutions who can help us identify the best opportunities for you folks. So really, really important pathway. It will, as we dig deeper, I'm sure we'll refine how we talk about it. But something to keep your eyes on, and to really think about how you might fit, whether these are opportunities you're looking for in the short term, medium term, while you relicense in a field that you worked in before, or start on a new pathway for a new professional career. So that's hospitals, clinics, industry. We're going to talk a little bit about dentists. I know at least one of the participants on this call is a dentist. The dental pathway can be very hard. Relicensing is a long process. It involves going back to school and doing a training program at a dental school. So it doesn't work for everyone. We have had success helping job seekers get jobs as dental assistants. And that's an area that's definitely ripe for opportunity. Also, we believe there are other opportunities in dental sales, dental equipment, and we're looking forward to getting together as a community and really talking about this pathway, drilling in together, sharing your expertise and knowledge. So that's dentists. Want to talk also briefly. I know a number of you on this call are pharmacists. Similar to dentists, a very complicated, long relicensing process. We're here to support you. We know that for many of you who do want to relicense, it is important to start off and get some work as a pharm tech, even though that's not highly paid or particularly professional. It is a way to get US experience, and oftentimes part of your licensing will involve some internship. So that's a pathway to that. Pharmacy is also an area that varies by state. So we want to be careful when we work with you to understand the different requirements and opportunities by state. We also know that folks with a background in pharmacy have had and will continue to have opportunities in the pharmaceutical industry. So we want to work with you to help you understand also in that space what skills would help you move forward, what opportunities, if you worked as a retail pharmacist in your country of origin, how do you transfer to be a pharm sales or work in product development or quality assurance? The pharmaceutical industry is a big, interesting world, and we are trying to build connections and use those connections and that knowledge to help you all find opportunities. And then finally, we have nurses in our program. We don't get as many nurses as other fields, but we know that nurses are coming to the US. The relicensing process is more straightforward for nurses. So sometimes they don't need our help. There are also other organizations out there, like in some communities, Welcome Back Centers, or in Illinois, the Chicago Bilingual Nurses Association that supports nurses. We're building our relationships with those organizations so that we can offer support in areas that they don't. We help folks on the path if they're interested in getting a more immediate job, get a job as a CNA or in other home health positions or entry-level hospital clinic positions. We can help with the licensing process. We are also interested to have a conversation if there are professionals from other fields who are interested in exploring opportunities in nursing. We know that there's huge demand in the United States for nurses, that nursing looks different in the US from other countries. If you become an advanced practice or nurse practitioner in the US, you will have opportunities to treat patients, prescribe medicine, work in management. So we really think it is a ripe pathway for people to explore, and are anxious to see where that conversation goes. So I think those are the pathways that we've identified to this point. We really look to you, our job seekers, for more insight as to what areas you're interested in pursuing and how we can support you, and how we can connect you to others in that sharing those interests. And now I'm going to pass this back to Layla, who will talk to us a little bit about the Slack community and why we're doing it and how we can do it.
Thank you, Tamar. So as you all receive an email for this webinar, within that email you will have seen that we have launched Slack this week. So you may kind of be asking, if you haven't already joined, well, what is Slack? Slack is essentially an app or a platform that allows us to message, and it's a great way to replace emails and email chains. So it's just this one, kind of application for Upwardly Global where you can message between your advisor. You can actually message between you and fellow UpGlo job seekers on group chats, large group chats that are called channels. And you can also do direct messages as well between you and your advisor or you and a job seeker. So we want to create a stronger community for you with fellow healthcare job seekers at Upwardly Global and with your advisor within this app of Slack, with Slack. And so it's a great way to kind of also take all of those emails that you get from your UpGlo job advisor about various opportunities, whether it's volunteer opportunities or job opportunities where we have a contact, or maybe job opportunities that we know of, but not necessarily have a contact at. We've been sharing those with you over email. And so you've probably seen a ton of emails from us. So Slack is such a great way for us to reduce the email, and we'll just put that all in one space within the channels that we'll talk more about. And we can share these opportunities and share resources with you. So it's just one succinct space with all of these resources and opportunities that you can easily access and find. And so I would like to give you a tutorial of how to use Slack. So whether you've joined or whether you're thinking of joining, you're not sure, you haven't joined yet, we of course encourage you to join. And so here is a tutorial on how to use Slack. So let's get started. Okay, so here you see this is Upwardly Global's Slack. It can be downloaded as an app on your iPhone, Android, or your computer on the web, or you can actually download the app on a computer like I have and like you see here. And again, Slack is a messaging system. So you'll see channels, you'll see direct messages. We'll talk more about that. But it's a way for us to replace emails and organize topics under channels or group chats. So here's the sidebar. And in the sidebar, you can see all the different kind of options. Channels are those group chats. Direct messages are private. If it's in bold, it means there's a new message that you haven't seen yet. So if something's in bold, you have an unseen message. So if you want to share something, you can click there to compose a new message, direct message, or channel. So let's try that. Here you can see I can message my colleague Isaac privately in a direct message, or I could also message the entire channel, so group. This includes a lot of people who are on that channel. Let's take opportunities as an example. I can message everyone in opportunities there. Let's talk about the different channels. So there's general, where we're going to make announcements and where we've also included guidelines that you should read about our community and our code of conduct. So check back there for announcements. And then for I'm new, when you join Slack, if you haven't already, please introduce yourself in the I'm new channel. This is a great way to just get to know everyone. As you can see, the UpGlo job advisors, we all introduced ourselves. Language corner. If you want to say hi in 1, 2, 3, or more languages that you know, this is just a fun space to say hi in different languages. And opportunities. This is where UpGlo job advisors will post about different job openings, or we have a contact, or we may not necessarily have a contact. We'll let you know. Don't post there yourself. Let your job advisor know if you have something you'd like to share, and they will share it out with the group if it's appropriate. And so you can see here, I've posted about Health Institute, and I've given instructions on what to do if you're interested. And residency. If you're thinking of applying, this is a channel for you. So we haven't included everyone, but as you join, if you're interested in residency, you can join. So let's go back to opportunities. So in opportunities, I'll show you how you can compose a message, just as an example. Remember, you can compose up there or down in this area. And there are so many different formatting options: bold, italicized, strike through. You can include a link. You can also mention someone. So if you want your job advisor to see the at and mention their name, and you can attach a file. Although remember, if you attach a file here, everyone in this channel can see it. So if you're thinking of sending your resume and you want it to be private, direct message it to your job advisor, like so, and that will be private. So direct messages are private, channels are not. So you can see how to attach a file there with your job advisor and chat with them. And you can also direct message fellow job seekers if you're having an engaging conversation and you want to take that conversation into a direct message, you can do so there as well. So as we've mentioned, we currently have those channels, right? We have general, I'm new, residency, opportunities. And we will be adding channels as we've discussed throughout this webinar. Kind of in the future, we'll be adding channels according to those different career pathways. And so just wanted to kind of let you know we'll be expanding on that, more to come. So if you haven't joined Slack already, my colleague Isaac has posted in the chat and will continue to post the link that you can use to sign up for Upwardly Global Slack. And if for some reason you don't see that, or it's just hard for you to find right now, you can always access the link to join in your email, the email that we use to invite you to this webinar. But if you don't see that or you're having any issues, please contact your UpGlo job advisor. So myself, Tamar, Patty, or Sarah or Isaac in New York region, and we will help you set up Slack. So we really encourage you to join Slack. Let us know if you have any questions or concerns. We are here to help. And this is a place for us to grow our community, open up communication, and get rid of all those email chains and put them all in one place for you to find easily. Over to Patty to wrap up and talk about next steps.
Awesome. Thank you so much, Leila. This was fantastic. I'm personally very excited about Slack because we have been sending out a lot of emails. So I agree with, with Leila. It will make our communication much more easy, simple, and yeah. So as next steps, what will you do? You will enroll in Slack. Of course, this is not obligatory, but we strongly encourage you. Then the next step is to stay tuned for the information about our next webinar for those, for all of you, of course, but especially for those who are interested in global public health, nonprofit, international development pathways. And even if you would not consider this as a pathway for you, I would still encourage you to join, because you never know if there's something that opens up for you the door, and this is knowledge, and you will always know something more than you know now, hopefully. And we're here to support you if you have any questions about this or today's webinar. So, strongly encourage you to join our next webinar. And the next I'm happy to see we actually have about 10 minutes for our Q&A. So I'm very excited about that. I think we already had a few questions. Let me see. Isaac, do you see any questions? My colleague Isaac will help me to gather all the questions we have. Let's see. Okay, I see one question from Jean-Jacques. Do we have any information about OBGYN physician? Is it a full physician or not? Is there any online course to have this license? That's a very good question. And based on my experience, I don't have a lot of job seekers who are going for the pathway of an OBGYN physician, but based on, and Tamar will probably jump in and correct me, but based on my knowledge and experience, I do have that you do still have to go through the licensing, correct, Tamar? Mute. You're muted, Tamar.
I am unmuted. I have got my voice back. Yeah, so for OBGYN, you have to go through the whole process as a if you want to be a doctor, to relicense, to take USMLEs and get an OBGYN residency, which can be very competitive. But that's something we can certainly have more conversation on. Yeah.
And also, I know Jean-Jacques is my job seeker. So Jean-Jacques, if you're interested in OBGYN, we can talk about alternative pathways offline. So feel free to schedule a call with me. I will make sure to remember that too. So I will reach out to you.
So Hebtala asked if Slack was going to be used to replace our email. Not at this point. We do not have full participation. The hope is it will be more efficient. We know that when we learn about opportunities, either job opportunities or training or learning, we as coaches spend a lot of time creating emails and not getting responses. So we would love to know how to find ways to be more efficient communicating. So that's the goal of this. But we certainly will not stop sending emails at this point. We hope to build a community and a communication forum that's a better use of our time and more useful to you all.
Exactly. And just to add, the advantage of Slack is, besides easier communication, that you all can communicate within each other, between each other. So you may find some similar interests, background, and experience, and connecting with each other. You both, let's say we have two dentists who want to share experience with each other. You all can connect, of course, with each other as well, which via email is sometimes difficult because usually we BC you in our emails, so you don't learn from each other. And this is a great opportunity for you all to extend your network and network and collaborate and connect.
All right. I'm gonna take Alexandra's question about regulations and simplification of regulations. Yes, we do work on advocacy. We're part of some national coalitions and conversations. We strongly believe that the process of licensing internationally trained medical grads and nurses and dentists and pharmacists doesn't benefit the country, does not benefit the employers, and we know there are many needs in our country for healthcare providers. So yes, we work on that. It is it's a complicated process. I have a colleague who is in charge of the advocacy piece. There has been some success. I'm not going to spend a lot of time here talking about it. There has been some openings in states who have had some emergency orders around COVID, and we've learned a lot. It's a slower process. We believe, our primary role at UpGlo is to help internationally trained immigrants and refugees get jobs within the current situation. So that is going to be our focus. But we also work on this advocacy, and certainly will keep you up to date. I think Slack will be a great place to share that kind of information as things change. Anyone else want to take a stab at a question?
I think you covered pretty much it, Tamara. Thank you. I wanted to relate to answer the dentist related question. So I have a few dentists that were successful in getting into a dentist area industry or dentist career through a fellowship. And the other job seeker got a job starting as a dentist assistant in a small family practice. So if you are interested in getting back into your field, sometimes starting small is how you can get your foot in the door and build up your network. And if you have a good employer that invests in professional development, you might be able to get opportunities through your employer and financial support as well. So this is an opportunity as well. I don't know how the other advisors, if they have any other experience, but these were my two examples, a fellowship and the other one through a family practice, starting as a dentist assistant, or even an admin role. I know this is not exactly what you're seeking for, but it may open up doors for future.
I agree, Patty. I've had the same experience with job seekers who have a background as being dentists, in the sense that they tend to land jobs as a dental assistant. And there are jobs as dental assistants that don't require certification, while some may. My experience in California has been that there are some dental assistant jobs out there that don't require certification. So I've worked with dentists who land jobs as dental assistants, and then in the meantime, while working in the job, are studying for the board exams and going through that licensing process.
This conversation is awesome. I think this is exactly why we want to have a Slack, so that we can have these specific conversations, that we can have it targeted, ongoing, and people who are interested can be part of it. So I really encourage you all to move forward and create a Slack. We're almost done. I'm wondering, Layla, if you could say another word for John and maybe other people about how to install Slack.
Yeah, so there's so many options. You can use Slack on your phone as an app. I recommend downloading the Slack app onto your computer. It's very easy. You would just create a username, password, and just like any other app, you would then download it. Keep in mind, if for some reason you want to keep your family last name private, the time to do that is when you're signing up. So you can just create like a simple username, for example, with your first name. And there's so many options of how to download it, but I recommend downloading the Slack app onto your computer and using it that way. So in the tutorial that you saw, it was the app that was downloaded onto my computer, and it's so easy to use. But you can also use it on the web or on your Android or iPhone, and you'll still get the same notifications.
I think this has been terrific. I think we've started a conversation. We've started providing resources. I hope you all will join Slack. I hope you will share your feedback, your questions with your job advisor, and continue to engage with us and engage with the Slack and this career community. And we're really excited to see how far we can go. I think we will wish you all an excellent day today, and we will be in touch soon. As Patty said, we are hoping to do another webinar specifically on international global health, public health, and nonprofit opportunities in a couple weeks, and continue moving forward with folks in other fields as well. Take care, and we'll see you soon.